Welcome back to Have More Babies. Today, we're really going to dig into the history of a medical innovation that, it's literally saved millions and millions of lives. The hepatitis B vaccine, or HBV. Our goal here is pretty straightforward. We want to pull out the essential life-saving facts from this incredible success story. We're looking beyond just the basics to understand, the decades of research, the global cooperation that it took. It really turned a scary global epidemic into something preventable for babies today. And here's maybe the most critical piece we want you to take away right up front. The history of this vaccine. It's actually the story of the world's first successful anti-cancer vaccine. We're tracing the steps that allowed science to prevent liver cancer years down the line just by giving a shot soon after birth.
That really is the essential context. And for you listening, especially if you're making decisions about your newborn's health right now, this conversation is basically a shortcut. It helps understand why the HBV vaccine is considered so fundamental today. We need to look at those key moments when this protection went from like a theory in a lab to a global public health mandate.
Okay, let's do that. Let's start at the beginning. Because, every huge breakthrough seems to have this almost accidental origin.
Yeah.
The first real game changer seems to be back in 1965 with Dr. Baruch Blumberg.
Right. And Bloomberg, he wasn't even searching for a vaccine component initially. His work was on inherited diseases. He found this unusual protein in the blood of an Australian Aborigine, and, well, he just called it the Australia antigen.
Just Australia antigen.
Right.
And what an unbelievable finding that turned out to be, huh? This protein was pretty quickly identified as the hepatitis B surface antigen, HBsAg as we call it now. This discovery was just massive, wasn't it? It proved the virus was there and gave scientists the exact target they needed to aim for immunity.
It was absolutely enormous, so significant it won Bloomberg the Nobel Prize in 1976. But the real legacy, beyond the prize, is that this single discovery, it laid the entire groundwork for developing a vaccine. Once they knew the target, the race was really on. And pretty soon, by the early 1970s, researchers had actually done it. They created the first generation of vaccines. These were the plasma-derived ones.
Okay, plasma-derived. Let's clarify that for listeners. That means they had to physically purify that HBsAg protein directly from the blood of people who were chronic HBV carriers, right?
Exactly.
That sounds like a huge undertaking. Heroic, yes, but relying on human blood donors for a potential global supply. That seems like it would have major logistical and maybe safety hurdles.
It absolutely did. It was revolutionary for its time, no question. And it led to the first plasma-based vaccine being licensed here in the U.S. in 1981. It was effective prevention. But you pinpointed the main issue. Relying on purified blood plasma always carried some risk, however small, and scaling that approach globally, it just seemed, well, near impossible.
Yeah. Okay, so that leads us directly to the next big shift. The move needed for real safety, real scale. How did they get around that whole blood sourcing problem?
This is where biotechnology really stepped up, and actually it happened pretty fast. The critical leap was in 1986. That's when the recombinant DNA vaccine came out. It was branded Recombivax HB. So instead of getting it from human blood, they used genetic engineering. They figured out how to make the hepatitis B surface antigen inside yeast cells.
Yeast cells, like brewer's yeast.
Basically, yeah. Think of it like teaching that yeast to become a tiny microscopic factory, a factory that safely produces the exact protein needed for immunity, but nothing else from the virus.
That's a fantastic way to put it. So the yeast makes the part of the virus that triggers the immune response, but there's zero risk of getting the actual virus or anything else that might be in blood.
Precisely.
Right.
That was the genius of it. This new method made the vaccine vastly safer, infinitely more scalable, too. It completely eliminated that worry about bloodborne contamination, which was a major public concern with the plasma version, and because it was easier to produce in large quantities.
Availability just shot up.
Exactly. Availability skyrocketed.
Which is absolutely crucial if you're trying to fight a disease on a global scale.
Yeah.
And we saw that effect pretty quickly, didn't we? A second recombinant vaccine, Endrix B, was licensed just, 3 years later, 1989?
That's right, 1989. And having that second option, that competition, it further increased supply and helped make this protection accessible basically everywhere.
Right. So this brings us neatly into, let's call it Section 3. The moment this moves from the lab bench into massive public health policy. This is where the story gets really interesting in terms of, actual lives saved on a huge scale.
Yeah, because before about 1991, HPV vaccination was almost always just targeted. They typically only vaccinate infants considered high risk, like babies born to mothers already known to be infected. The policy sort of assumed they could catch everyone who needed it that way.
But that sounds like it leaves gaps. What about people who didn't know they were carriers?
Exactly the problem. In 1991, the CDC's Advisory Committee on Immunization Practices, the ACIP, here in the U.S., they recognized the danger of that silent transmission. They realized, targeted vaccination just wasn't enough to stop the spread. Too many carriers were unknown. So that 1991 decision, it was truly a watershed moment. ACIP formally recommended that all infants should get the vaccine. It was a huge shift, from just reacting to high-risk situations to aiming for universal prevention. A totally different philosophy, really. It acknowledged the only way to truly wipe out the infection in kids was to protect every single one.
And connecting that to the global picture,
Yeah.
it seems like the momentum picked up worldwide almost right away.
It did. Because the recombinant vaccine was so clearly safe and the argument for universal prevention was so strong, the World Health Organization, the WHO, followed suit very quickly in 1992. That WHO call was critical. They urged all countries to include HBV vaccination in their national immunization programs. That really set the stage for the incredible drop in infection rates we see globally today. But getting that level of political and, frankly, logistical buy-in worldwide took immense cooperation.
And here in the U.S., that policy change was backed up by some really important groundwork too, right? Like the perinatal hepatitis B prevention programs.
Yes, absolutely. Throughout the 2000s, the U.S. really focused on expanding those PHBPPs. The goal was to close any remaining gaps, especially for those highest-risk babies.
So that meant things like active tracking, making sure babies born to HPV-positive moms got that first shot literally within hours of birth.
Exactly, within hours, plus the hepatitis B immune globulin and crucial follow-up testing. It was a belt-and-suspenders approach to guarantee zero transmission in those very vulnerable cases.
Okay, so now we get to the payoff, the proof. Because the real measure isn't just the science or the policy decisions, it's the actual impact on people's lives. And the HPV vaccine seems to offer some of the clearest data we have in medicine.
It really does. We don't need complicated models. We have real-world results.
Starting with that incredible case study from Taiwan back in 1984. They didn't just do a small pilot, did they? They went nationwide.
That's right. Taiwan became the first country in the world to adopt universal infant HBV vaccination for all babies. It was, in effect, the world's first giant controlled study on this.
And the results.
They were stunning. Within just 10 years, childhood HBV infections plummeted across Taiwan dramatically. But here's the most powerful part, the part that connects back to what you said at the start. It wasn't just about infection rates. By the 1990s, years after those first vaccinated cohorts grew up a bit, researchers saw that rates of childhood liver cancer had also declined significantly.
Wow.
That was it. That was the undeniable proof, the legacy. By preventing the HBV infection in babies, the vaccine was actively preventing cancer later on.
That's just staggering to think about. Not just managing a virus, but actually stopping a future cancer before it even had a chance to start. And we saw similar success here in the U.S. too, after the 91 recommendation.
Absolutely. Following that universal recommendation, new HBV infections among children in the U.S. dropped by nearly 90% between 1991 and 2002. It's often cited, and rightly so, as one of the biggest public health wins in modern vaccine history. Just a dramatic success.
So bringing us to today, what does that legacy look like now globally?
The success story continues. Global coverage for the full 3-dose series is now over 80%, which is fantastic penetration. And crucially, the prevalence of chronic HBV infection among kids under 5. It's dropped from almost 5% before these programs really took hold to now under 1% globally. Just incredible progress.
Under 1%, that's amazing.
It really is. Which leads to the final and maybe most important point for parents listening now. Why does all this history matter today? It matters because the HBV vaccine holds this unique status. It is the world's first universally adopted anti-cancer vaccine. The history we just walked through, that's the solid track record. It proves that the protection given at birth is genuinely safeguarding that child against not just a lifelong illness, but also against a future risk of liver cancer, potentially decades down the road.
So when we look back at the history of the hepatitis B vaccine, it's so much more than just dates and scientific names. It really is this clear, successful legacy of transforming public health, saving lives by giving proactive, long-term cancer prevention, starting right from day one.
And maybe the provocative thought to leave you with is this. Every single parent who chooses to vaccinate their newborn today isn't just making a choice for now. They are actively participating in this verifiable, decades-long public health success story. They are protecting their child from a serious disease and significantly reducing their future risk of cancer. It's one of the most profound, proactive health decisions you can make. For those of you who want to explore this more, maybe get deeper insights into the specifics for your own child, we strongly encourage you to visit omegapediatrics.com. There's a wealth of detailed information there related specifically to infant vaccination schedules and benefits. That's omegapediatrics.com.
Absolutely. Thank you so much for joining us for this discussion on Have More Babies.
Yeah.
If you found this information useful, and we hope you did, please do like the video, subscribe to the channel so you don't miss future conversations, and please share this with other parents, friends, anyone who might benefit from understanding this important history. We'll see you next time.